Yes, our topic antidotes and its clinical applications in acute or chronic poisonings. So first let us know what is antidote. We commonly come across this name, and importantly many poisonings do not have a specific antidote. We've got universal antidote, charcoal, but when come to specific poisonings where we are available having a specific antidotes, it's very important to use them in early scenarios which will have a speedy recovery of the patient. So what is antidote? Antidote is a chemical or therapeutic substance used to counteract the toxic effects of harmful xenobiotics. The substance which is helping us to counteract or to shut down or to reduce the poisoning effects, therapeutic poisoning effects. So how they act? So you have to be very cautious about how they act, what are the mechanisms of action of the antidotes, and what are the classification, because classification also helps you dealing with antidote poisonings. So before having a brief idea about the antidotes, you should learn about two important things in pharmacology: this agonistic activity and antagonistic activity. What do you mean by an agonist? Agonist is a drug which will bind to receptors. Again, the question arises: what do you mean by receptor? There are a lot of receptors in our body. All pharmacological drugs act through receptors, whether they may be ion gated or maybe G protein coupled. So, a agonist bind to a particular receptors and have its effect. That is called as agonist. An antagonist, they also bind to the same receptors, but they do not produce any effect. That is zero effect. Hence, it is called as antagonist. So, agonist is a drug which bind to the receptors and produce a maximum effect. Antagonist is a drug which bind to the receptors and do not produce the effect. So, agonist, antagonist, and antidotes are almost same. Now, how these antidotes work? What are the mechanism? They act by becoming causing a complex formation. For example, any poison enter into a body, and these antidote go and form a complex with that poison, and it will prevent the further use of this poison. For example, it not causes absorption, it is fastly metabolized or do not metabolize, and is easily excreted. So one basic mechanism is formation of complex formation. Antidote goes and binds and they form a complex. And second mechanism, they prevent the formation of toxic metabolite formation. You know, any drug which enter into body, absorb, distributed, metabolized, and this one. There are some words called prodrugs which are entered into our body and they become active drugs. So sometimes this activation of this inactive metabolite to active metabolite occurs in our body. For example, cyanide. Cyanide is usually inactive substance. Whenever it combines with any water, it becomes a poisonous substance. So sometimes these drugs prevent the formation of toxic metabolites. Second mechanism. And third is metabolic conversion. Again, the poison is not processed properly. It prevents a further metabolic conversion into active or poisonous substance. And third is by changing the physiochemical nature of the poison. You know, everything depends on physical property and chemical properties, pH values, lipid solubility, lipid insolubility. For example, these are important factors for the absorption or further processing of the drug or further pharmacokinetic of a drug in our body.